Madini has 6 children. It has been a struggle to support them. Does she want any more?
No.
Her response was clear. She was then asked how many children she would have liked if she could have chosen. Her reply was 2, but she didn't have any choice. Aisha got pregnant as a teenager. She knew nothing about contraception. The father of her child has deserted her. She doesn't want any more children, at least not in the near future. She wants a job, any job. These are typical stories of sub-Saharan Africa. In the last 25 years, Kenya's population has almost doubled and 35% of young people are unemployed. Food and water shortages increase as environmental degradation accelerates. But there are glimmers of hope. Chase Africa works with a number of organisations across Eastern Africa, in particular in Kenya and Uganda, that are providing services to enable couples and women to make their own decisions about how many children to have and when to have them. One of these is Dandelion Africa, based in Mogotio, Baringo County, in Kenya. Dandelion was set up in 2009 by Wendo Azed to help those in rural Kenya with no access to healthcare and family planning due to distance, lack of information and poor infrastructure. Chase Africa supports the Dandelion Mobile Day Clinics, which visit remote and marginalised areas with a team that includes doctors and nurses hired on a locum basis from Kenyan government hospitals. 1 or 2 weeks before a clinic arrives, mobilisers are sent out into communities to tell them about the clinic and explain what services will be available. Mobilisers are local people who are chosen by their community and given basic training in healthcare and family planning. All services are provided free of charge, some with support from the Kenyan Ministry of Health. As Wendo tells us,
You will pay for 3 implant-on, you'll pay anything from 500 shillings to 5,000 shillings, depending on where you go. And the daily wage is like 100 shillings to 150 shillings a day. So clearly family planning will not be your priority because you might have to work for a whole week to be able to afford it, and then you have all these kids you have to feed and everyone is depending on you. So that puts a pressure on everything.
The mobile day clinics provide general, medical and pharmacy services, vaccinations and child support. They also do HIV screening with a pinprick test that is offered along with advice and counselling.
We have about 1.6 million people living with HIV now. In certain places, in certain regions, we have up to 5,000 new infections a year. Younger people are using protection more. Married people are not. So it is a time bomb.
However, the main focus is the delivery of family planning services. Individual counselling is offered to help dispel the often widespread myths and misinformation about the various forms of contraception and, most importantly, raise awareness of the benefits of family planning. Most women choose long-acting, reversible contraceptive implants. These are inserted under the skin on the inside of the upper arm after the injection of a small amount of local anaesthetic. The implants are effective for 3 years or 5 years, depending on the type, and do not require a pill to be taken every day.
We have this conversation all the time asking if now you have 12 kids, if you had to reset, and they say, I love my kids, yes, but if I had to reset, I'd probably have 3, I'd probably have 2, because it's tough. Kenya is difficult, it's expensive. So they're making that conscious decision either to stop completely or talk to their daughters to say, okay, I had 12, yes, but you don't have to have 12, and that will be better for you.
Gladys is so grateful for the help she received from Dandelion that she now works as a volunteer at these mobile day clinics.
I am 32 years old and I have 4 children.
How did you hear about Dandelion and the family planning service?
I heard it from a friend, a close friend of mine. She told me about the program, so I went to Sachangu, another place they were doing out there.
Yes.
Then I started using the implant from them.
When did you have the implant?
Last month.
And would you ever like to have any more children?
No, in fact I'm regretting right now. I wish I had one.
Okay.
Because the living standard is too high, I cannot afford to pay their school fees and to gather for their basic needs. For me, I thank Dandelion so much for what they are doing to the community, especially me. You know, going to a hospital for an implant is expensive. You know, you'll pay for it, but for the Dandelion, they give it for free. So I thank them so much.
Thank you. Have they done anything else for you apart from the implant?
Yes, the deworming for my children, even medication.
Yes.
Yeah, that is it. And now I'm working for them today. Maybe they give me something at the end of the day.
Okay.
Yeah, I like that.
Well, that's great. Thank you very much for talking
Okay, you're
to us.
welcome.
Most mobile day clinics are attended by hundreds of people, both adults and children. A mobile clinic is a fun and educational day out. Clowns entertain the children and give short talks to groups of young adults on topics such as basic hygiene, contraception, and how to stay healthy.
Education is everything. If you don't have information, you don't have education, you have no power over anything. You have no power over what you want for yourself and what other people want of you. You can't have a say. So I think awareness creating, information, making sure women get information right from primary school. We shouldn't wait for women to have kids and then start talking about contraception. It should be from basics. So it's very important for them to have the right information from the right source and then use that information to decide yourself.
The practical support that Dandelion gives on guidance and services related to enhancing women's rights and reproductive health is greatly appreciated and respected in the communities where the charity works. We would like to give Dandelion and our other partners the opportunity to do more, to reach more communities with healthcare and family planning, to educate and inform more people of the benefits of family planning, and to build on the work that has already been started. Will you help? Visit chaseafrica.org.uk to find out more and get involved. Thank you.